Hey guys, this is VJ, and this is your PSA on squamous cell carcinoma. So what is it? It's a type of skin cancer classified as non-melanoma skin cancer. There are two types of non-melanoma skin cancer. These are basal cell carcinoma and squamous cell carcinoma. It is defined as an uncontrolled growth of abnormal cells arising in squamous cells. It may occur in all parts of the body, including the mucous membrane and genitals, but most commonly in areas exposed to the sun. Some signs and symptoms of the disease are scaly red patches, open sores, warts, elevated growth, and occasional skin bleeding. As you can see in the bottom right picture, some of these symptoms are displayed. So who gets it? Pretty much anyone with a history of substantial sun exposure, but more specifically, people with fair skin, light hair, and blue, green, or gray eyes are most susceptible. The major causes of squamous cell carcinoma are a chronic exposure to sunlight, frequent use of tanning beds, infections and skin inflammations, immunodeficiency viruses, and inheritance. The presence of an immunodeficiency virus will make the host's immune system weaker and therefore make this person more susceptible to getting squamous cell carcinoma. It is also a heritable disease. There are several available treatments for squamous cell carcinoma. These include Mohs micrographic surgery, excisional surgery, keratogen electrodesiccation, also known as electrosurgery, cryosurgery, radiation, and laser surgery. Briefly about each one. So, in Mohs micrographic surgery, the physician uses a scalpel or a curette, which is a sharp ring-shaped instrument, to remove the visible tumor with a very thin layer of tissue around it. This layer is immediately checked under a microscope for thoroughly. If the tumor is still present in the depths or peripheries of the surrounding tissue, the procedure is repeated again. The cure rate for this method is around 95%. In excisional surgery, the physician uses a scalpel to remove the entire growth along with the surrounding border of apparently normal skin as a safety margin. The damages are then stitched up. The cure rate for this method is 92%. Using electrosurgery, the growth is scraped off with a curette, and burning heat produced by an electrocautery needle destroys the residual tumor and controls the bleeding. In cryosurgery, the physician destroys the tumor tissue by freezing it with liquid nitrogen. Using a cotton-tipped applicator or a spray device, there is no cutting or bleeding and no anesthesia required. The procedure may be repeated several times at the same session to help ensure destruction of all malignant cells. Over a 5-year span, the cure rate for cryosurgery could be up to 95%. In radiation, X-ray beams are directed at the tumor with no need for cutting or anesthesia. Destruction of the tumor usually requires a series of treatments. The cure rate for this is around 85 to 95%. And finally is laser surgery. The skin's outer layer and variable amounts of the deeper skin are removed using a carbon dioxide erbium laser. The method is bloodless and gives the physician good control over the depth of the tissue removed. It actually seals blood vessels as it cuts, making it useful for patients and blood bleeding disorders, and is also sometimes used when other treatments have failed. So that's my presentation. I hope you learned a little bit more about squamous cell carcinoma. Thanks.